When I said the relationship between Cuba and Ethiopia is written by blood, it's because when our freedom was threatened, as you know, some 3 or more decades ago, Cubans were the first to come and help us. And many troops actually even paid from Cuba, paid their life for our freedom. And that's why we built a monument in Addis Ababa in honor of those who sacrificed their life for our freedom. And that's why I said it's written by blood, because Cuba helped us when we were in difficult times and when our freedom was at stake. So that's why we have a very, as people, we have a very strong feeling about this kind of bond, and Ethiopians actually appreciate this, and this is something that we will cherish forever. You know, we have very strong relationship in terms of politics, both bilateral, multilateral, diplomacy, and as I said, other issues related to it only. But in terms of trade and investment, our relationship is not as one would expect. It's not really in line with the strong and historic relationship we have. And during my trip, we stressed that there is a need from both sides, from Cuba and Ethiopia, to strengthen especially that weaker part of our relationship, trade and investment. Cuba's health system is actually something that the whole world can learn from. It's a strong health system. The reason I'm saying is because of several reasons actually. One, it focuses on primary health care, the family doctor's approach. And family doctor and family nurses are very close to the communities to give them service, not only in their facility, but also they go even house to house to visit their patients. And this is very important. And not only that, you have also a polyclinic higher than that. And the two first line or the primary health care institutions focus mainly on prevention. And prevention, as you know, is better than cure. And the strong focus of Cuba on primary health care and on prevention is very, very important. But not only that, there is universal coverage also. This is not even achieved in very developed countries. So Cuba, with less economy, has shown to the world that it can provide to its people universal health coverage and with a good quality of services. So that's why I said the world can learn from Cuba, even with meager resources, that it can provide to its people good quality services. But not only that, Cuba also produces many of the essential drugs it needs. That's another good lesson. And also it produces, out of the 13 vaccines it uses, around 10 of them in country. That's also a very important lesson. And that's helping Cubans to have access not only to health services, but to also good quality medicine, which is actually a problem in the rest of the world. And the whole world is struggling with poor access to drugs, and people are dying everywhere because of lack of access to medicine and to services, and the financial barriers also that's preventing them from accessing health services. So that's why, as a health professional myself, I believe that the Cuban model is a good model that the world can learn from. But Cuba not only is providing good services to its people, and it's also helping many countries. As you know, 50,000 Cuban doctors are working health professionals. Most of them doctors are serving in many countries throughout the world, and Ethiopia is one of them. And not only we have benefited from the services they provide, but they helped us train our doctors also. And then the other part is the courage of your doctors, which really impressed us all. When they were sent to Sierra Leone, Liberia, and Guinea-Conakry to fight Ebola. And they were the first to arrive and help these three countries in our continent were affected by Ebola. And that solidarity is also something that we will not forget. As an African, I'm very, very happy that Cuba is on the front to help. And by the way, this is not surprising for me because, the natural and historic relationship that Cuba has with Africa, with our continent. And it was not surprising that Cuba actually took the lead and came to help. And not only as government, but the Cuban health professionals, we have witnessed, all of us, were very courageous and even exposed themselves to help others. Not only you have good health system, but it's focused on research and development also. And I have visited the Institute of Tropical Medicine, Pedro Curi, and of course I know about that institute even when I was doing research myself on malaria and other tropical diseases. And it was for me a dream come true when I visited the institute, because I used to see what research that institute was doing, which is related to my interest. And I have always wanted to come and visit that institute. So I'm very proud to meet the professors there, the researchers, and they gave me a very good explanation of what they're doing. And the world can learn also from the research and development you do here with less resources, but very good quality research. And as you know, Pedro Curi, the institute, is a collaborating center on many areas with the World Health Organization and with PAHO also. And you should be really proud of that. But still, I believe this institute can do more. And the World Health Organization and PAHO can really use this opportunity that Cuba has provided to replicate in the rest of the world and to bring the health status of our world to a higher level, a better one.